Hello, my name is Victoria, and I will be presenting an audit of intraoperative blood glucose monitoring for patients with diabetes. Diabetes mellitus affects approximately 10 to 15% of patients presenting for surgery and is associated with increased perioperative morbidity. Both hyperglycemia and hypoglycemia contribute to adverse outcomes, with perioperative glycemic dysregulation occurring frequently. Current guidelines from the Center for Perioperative Care recommends maintaining intraoperative blood glucose between 6 to 12 millimoles per liter, with a blood glucose measurement prior to induction and regularly during procedures 2 or more hours. We therefore completed this audit to evaluate compliance with these international recommendations and identify areas of improvement in perioperative diabetes management. A retrospective clinical audit was performed for all patients with diabetes undergoing surgery at University Hospital Limerick over a 1-week period. We excluded any patients with gestational diabetes. A total of 110 surgeries were reviewed, with 17 surgeries on 17 different patients included, giving a diabetes rate of 15%. All of these patients had type 2 diabetes, and 76% of these surgeries were emergency procedures. Analysis against the CPOC standards showed 88% compliance with measuring pre-induction blood glucose levels, 58% compliance with intraoperative, and 88% compliance with the recovery room blood glucose measurements. Of note, 8 surgeries compliant in the intraoperative measurement did not require any blood glucose measurement due to the duration of surgery. With these surgeries removed, compliance intraoperatively fell to 18%. A total of 9 hypoglycemic events of less than 6 millimoles as per the CPOC guidelines were recorded, and a total of 4 hyperglycemic events were recorded. Appropriate management was only documented for 1 hyperglycemic event. In summary, this audit shows variation in monitoring of blood glucose for patients with diabetes and poor adherence to recommended guidelines. Timely recognition and clear documented treatment of perioperative dysglycemia is needed to ensure optimal management and prevention of adverse events for this vulnerable group. Moving forward, we are planning a teaching session to both anesthetic and nursing staff on the importance of identifying patients with diabetes early and monitoring of blood glucose in the perioperative period. We will also conduct a survey to establish barriers to recommended monitoring criteria and provide solutions for these, such as documentation prompts to establish reminders. Following this intervention, we will re-audit in 6 months' time to track improvement in our compliance and improve the care for diabetes patients perioperatively. Thank you.